Um, I'm very happy to introduce you to our work that we have been doing for the last 10 years. And I think we're very proud of that work. And I hope I can transmit that to you this afternoon. So now if I can, that challenge, okay. Doesn't go forward, please. Okay. The other. Well, we started out, we were 3 people 10 years ago, and now we are a big team, and it has been a lot of fun doing that work. Well, there are 14 full-time people working with us, and there are 54 freelance people working with us, and now I will tell you what they do. Well, the WHO is suggesting a 7-stage model of how we should develop dementia services. And I think this model is very interesting because it also includes a section on how we should actually do the services in the pre-diagnostic phase. And I think this is very interesting, and that's what I'm going to focus today a little bit on, and that's the focus of my presentation basically. So all the dementia care plans are actually focusing on early detection. This we have been hearing at this conference, of course, also. But what are in fact the advantages of early detection? You know, some years ago people would say, well, why would we do this? There's actually no benefit for people with dementia if they knew early. Well, I never thought this is true. Well, we know today, the literature is telling us a great deal about it today. We are able to prevent crises, promote disease adjustment, so that these are really important things that people have to do, and they have to get the chance to do it. So the earlier, the better. People, I always think, my impression is when I work practically, is that people know much earlier than any doctor that there's something wrong and they have this disease. It may improve quality of life, we know that, and facilitate actually the referral to the right services. So we started out to develop this model saying, well, there's no cure, so what can we do for people with dementia to actually live a good life and have a good time? So these were the first thoughts we had on that. So we really wanted to react emotionally to this challenge at first. So we started to listen to people with dementia. We organized focus groups. We asked them what kind of services they would like to have, and we also asked the caregivers. So from these results of these interviews and confrontations, we developed. We heard first of all the main issues. What did they say? What did they want? So one of the most important issues was, when was the best time to actually get a diagnosis? When should I confront myself with this? Is there a best time, and where should it take place? How can I receive and where can I receive support even in the earlier stages of the disease? So this was very important both to the person with dementia and also with the family member. So where can I get really appropriate information about the disease and advice in difficult situations? So these were the main issues voiced. So we developed goals for the structure that we were about to erect. Well, we immediately or very early saw that the structure needs to be specifically designed to the needs of people with dementia and their family carers. So it can't be just a regular counseling center for all kinds of problems in the community. It's a really specific issue. It needs to be easily accessed. It should be a low threshold structure, so people really walk in and get information and are not scared. So we thought that early disease detection, the best way to achieve this is actually listening to the needs and ask people what do they need in order to be able to accept it. We also immediately or very early in the development of the structure saw that a one-stop shop is important, so people can shop around. What do I need? You know, where do I get it? They just don't have the time and the strength to do it. It should be long-term individualized. You know, long-term doesn't mean I don't need one counseling session. I may need more in the term of the disease. And very important for us was the development of a positive life concept. So how can we help people to have a good life despite the fact that they are touched by the disease? So one of our major goals was, of course, also prevent premature institutionalization. What does the caregiver need in order to be able to achieve this goal? So that's how the treatment pathway looks like. People approach the Dementia Service Centre by, you know, they can just walk in or they can call. Most of the people actually do call. Then we ask them whether they would like to have a screening done. Well, if they agree, and most people do agree actually, then we do that. And then they have the possibility to make a decision whether they accept the stage-specific training. And for the caregiver, we have counseling, training, and support sessions available, as many as needed. Well, we also look whether there's a medical diagnosis. If there's one, we help the family understand it, and we network with other organizations. Of course, everything that's available is given to the family this way. We re-evaluate people every 6 months or 1 year upon request. Theoretically, the structure is founded in the stage specificity. So we try to deliver all the services in a stage-specific manner, meaning the stage-specific training, understandably, and also the caregiver training, and especially caregiver groups. You know, you can't really put caregivers whose person with dementia in the different stages in the same support group. That's what we think. So the stage-specific training is basically a global stimulation program that has several aspects that here they don't come up. So it's memory, IADL, perception, games, and physical training. The training modules for the caregivers consist of those 5 modules. And we have 3 types of professionals working in the structure. So there's the social workers. They are more or less leading the Dementia Service Centre, doing all the organizational work, and also work, of course, with the families. Then there's the clinical psychologist doing the testing work and also the counseling. And we developed a new profession, so to speak. These are our trainers. We tried to work with therapists, but they were not available at the time we started. So we kind of created, it's a model of a kindergarten teacher with multiple therapeutic skills. And so these people work especially in the training, but also counseling of family members on site in the families. We have 6 such centers established by now. Now a 7th center was added. And we collect data from all the 6 centers. So we looked briefly, we looked at whether we reached the goals that we set in the beginning. I looked at 2 variables for this presentation. So we looked at 1,796 persons, and these are the characteristics of the population. And we looked whether we really reached the goal of early disease detection. And I think we did. If you look at the distribution of the global deterioration scale, this is the severity of the disease. And so 43% of persons are in stage 3, 4, and 5. And especially 3 and 4, which we consider early detection, was 43%. So that's quite interesting. And it stays stable. So if we look over time, it was interesting. So I also looked at the acceptance of the stage-specific training, and we registered from the 1,796 persons. 1,014 agreed to participate in the training. So that's a quite high percentage. Interesting was that we were surprised to see that very few people, caregivers actually participated in the training modules. This was a little bit disappointing. We have to look into that, why that is. The cost for the family, this is a program that is funded by the state of Upper Austria. So there are no costs for the family at the moment. As psychological screening, counseling, and support of the care provider is concerned, there are no costs. There is cost for the training, however. So families have to contribute to the cost to the training sessions. So I can conclude. We have a high percentage of persons in the pre-stages and beginning stages of dementia attracted by this structure. And it's very interesting. What we also see is that we have very few people that actually come to the center that have other diagnoses. That was surprising because, and I think why this is because we are recruiting people a lot through public relation mechanisms. So, and this is a very clear message, and I think that's why the service is also perceived as a very specific service for this problem. More than half of the baseline population accepted a stage-specific training, so it's half. It seems to be high, it's good, but I hope that we can further increase the amount of people that are attracted. We have to analyze the reasons why people, don't participate in the training groups. However, whoever starts to participate stays in it. That's very interesting. The families stay with us for a median of 2 years, and extremes up to 12 years by now. So that it's truly longitudinal. The main hurdles for non-participation we have to analyze now. We're looking into this currently and see what we can do and improve to attract people to participate. We identified main hurdles, which is, of course, transport problems. And whoever knows Austria in the rural regions knows what this means. It's a very long way anywhere. So there are problems, and sometimes people also have no support provider. So this also can be a main hurdle why they can't participate. The support provider training course participation was also very low, and we see this growing actually, and we think because support providers or caregivers really look for information informally. They avoid groups, and they just see where they can get the information, and the trainers do a lot of this job in our structure. So we published all this in a little more in a paper now. This will appear in the Dementia Journal, and there's more about the goal orientation and service development. And the structure is now tested, piloted with our national insurance company to implement the structure in the actual day-to-day life of Austrians. So it's prepared for rollout, and we're very proud about that. And so the aspects of the model are in-depthly tested once again with other organizations, which is wonderful. so we can start to collaborate on a bigger level and collect data, because everybody agreed to collect data together. So that's a big victory, and we're very proud about it. Thank you very much for your attention.